to take place. Belden Walyeula, KTN News.
Or still at Afia House, where the Ministry of Health has been ranked the second most corrupt institution in the country by the Ethics and Anti-Corruption Commission. It is in the report on corruption and unethical conduct in the healthcare projects. EACC says favoritism, conflict of interest, and of course bribery were the most prevalent forms of corruption and unethical vices that bedevil that institution. Gloria Milimo reports on what ails the Ministry of Health.
Barely weeks after it was hit by another corruption scandal at its medical supplies authority, cancer, that has now turned into a playground for corrupt individuals in the country, the Ministry of Health has yet again come under scrutiny over integrity issues. The institution that has been roped in scandals in recent times, among them COVID billionaires and misappropriation of donor funds, has tainted Kenya's image among the international donor community. The recent scandal involves a 3.7 billion shillings tender for mosquito nets. The ministry has now been ranked the second most corrupt institution in the country, reinforcing concerns about the sector's integrity. A survey conducted by Ethics and Anti-Corruption Commission (EACC) that sought to identify the nature, magnitude, cause and processes that are vulnerable to corruption and unethical conduct in procurement and financing management in Kenya healthcare projects exposed the plague that ails its procurement and financial management systems. The EACC report indicates that favorism dominated the tendering phase in 3 phases of procurement.
The highlights of the findings have been mentioned to us, but it includes high prevalence of corruption and unethical conduct in the provision of services in the health sector, malpractices in public procurement and financial management in healthcare projects, ineffective information management system in healthcare project management, and inadequate anti-corruption measures to address malpractices in procurement and financial management in the sector.
Making payment for substandard works and bribery were the most prevalent forms of corruption and unethical conduct at the post-tendering phase of health projects. At the budgeting stage of the procurement process, cost inflation, undue influence and collusion were most prevalent. Similarly, cost inflation, misappropriation of funds and bribery dominated the list of the most prevalent forms of corruption and unethical conduct of commitment phase.
The report, which draws from extensive field research across 25 counties, describes the specific integrity risks that exist in all phases of the public procurement cycle.
The report also reveals that bribery payments were mainly in form of cash, with the highest amount of bribe paid for health projects being 3 million shillings, with the least being 5,000 shillings, as others were forced to part with 10% of the project value as a bribe. County government employees topped the list of shame of those who were receiving bribes, according to health staff interviewed during the survey. At least 4 out of every 10 contractors indicated that it was common for them to pay some irregular payments or gifts to get things done. 3 out of every 10 said they knew in advance what was to be offered as an irregular payment or gifts, according to EACC's report. When it comes to termination of healthcare projects before completion, Embu, Kitui and Meru counties ranked the highest, while Mombasa, Kisii and Marsabit had the lowest levels of projects terminated before completion.
This report obviously then gives me impetus to deepen the reforms that I have started working on, geared towards an accountable healthcare system in this country. Secondly, the report allows us to put more focus on the issues affecting healthcare delivery to the people.
The ministry now hopes the report's recommendations will inform legal policy and administrative interventions to address the deep-rooted issue plaguing the sector. Gloria Milimu, KTN News.
After the break, more